Hi, I'm Dr. Kenik, and I'm a practicing rheumatologist. Two of my particular interests are both osteoporosis and rheumatoid arthritis. This is a very dynamic time in rheumatology where we have a number of new therapies available to us. We've raised the bar in terms of our treatment outcomes, and while we are unable to cure many of our conditions, we do try to achieve remission in the majority of our patients. I became a physician for a number of reasons. One, as I was growing up, I was always intrigued by science. I always enjoyed science. I was also inspired by my neighbor, who was our family physician. I did not want to be in a field that was static or stagnating. I wanted to be in an area that was dynamic and always expanding and challenging to me. And finally, and most importantly, was the opportunity to serve. I chose to work here for the same reason I chose to go into rheumatology. During my training, I had the opportunity of working with a rheumatologist who came in and staffed a clinic, as we did not have rheumatology here at Creighton. I enjoyed the discipline. And as a result, I was encouraged to seek further training and do a fellowship in rheumatology, and given the incredible opportunity to come back and start a rheumatology division here. My favorite part about being a doctor is a number of things. One is the satisfaction of dealing with patients and healing their pain and suffering when I have the opportunity to do so. And selfishly, I have the opportunity of working with many of my closest friends and colleagues over the past 30 years, many of which I went to school with. And finally, the opportunity of working with students and house officers who don't allow me to become complacent and keep me on my toes. I would hope that patients would expect from a visit with me that I will use my 30 years of experience to listen carefully to their complaints, diagnose their problems, and ultimately alleviate their pain and suffering.